Hi, I'm Tony Moore. This is my capstone project or presentation on brain-computer interfaces. Specifically, what does the public know about them? Like most things that come out, anytime there's new technology, lots of times people they use it, they embrace it, but they don't really understand what it is or know why. So I want to go and talk a little bit about this because it came across the subject about a year ago and it really intrigued me. So I was curious to follow up with it, and I'm glad I got a chance to do it for this program. So you have to start out by asking what are brain-computer interfaces? Simply, BCIs or brain-computer interfaces are devices designed to detect brain activity that corresponds with the intent of the user. That intent is then translated into an output that can be executed by a machine. And I have several examples here. It's not all inclusive, but these are some of the most common ones. So for example, electric wheelchairs, mobile robots that can do things that the user can't do, artificial limbs, so where they can go ahead and actually use the body's electrical system and nervous system to go ahead and, as you see in the picture there, to go ahead and make a functioning artificial limb. And use computer keyboards. There's a study done that showed that you can actually use a BCI with the right interface and the right setup to go ahead and let someone type on a keyboard so they can access the web, type letters, communicate, email, just like we do every day. Now, there are several kinds of brain-computer interfaces, but they're all really designed to give patients who are paralyzed or locked in the ability to go ahead and have a little bit of restored mobility. And you can see an example here that there's sort of like an exoskeleton, and you can see the two gentlemen in the picture wearing the caps that have the electrodes that are transmitting their thought impulses to an output that is designed to move, in this case here, the legs that each one of them is wearing. They do have some limited ability to control their environment using BCIs. This is often done through household appliances, things like that, where they can use voice control to change the thermostat. They can go ahead and do certain other things as well around the house. Gives them the ability to communicate. I've already kind of alluded to this based on the keyboard, but you can also use these brain-computer interfaces to allow you to speak. Stephen Hawking used a similar device to communicate, and obviously he couldn't, he was paralyzed with ALS, but he was still able to communicate. And these types of devices allow people to do that. Now, the types of brain-computer interfaces that I came across in my research were, you have non-invasive. So essentially, you have somebody who is wearing a cap. In this case, it's in this, I can't pronounce it, but you can see all the electrodes that are hooked in. The electrodes are transmitting his thoughts about doing something into a computer that interprets what he's thinking to try to go ahead and take an action. And the non-invasive, it works well, but it's not completely reliable because the variations in the sensors and the person's skin, the thickness of the scalp, and so on. You also have invasive, however, though. The invasive, as you can see here, you could actually, scientists, surgeons, however you want to call them, will hook electrodes directly onto the brain. So they will go ahead and cut holes in the person's skull, and they will use devices to go ahead and connect electrodes. There are also more invasive methods where they actually will go ahead and put the electrodes inside the brain, not just on it, but inside. Those don't happen as often. It's a much more risky procedure, but the invasive BCI is much more effective in terms of capturing that person's thought process on how to do something. And of course, every time we do something, you see technology come out, there's always some unforeseen side effect, and things that look good on paper don't always translate well. Sometimes, just doing it, you don't realize after the fact that, oh, well, wow, there's an issue here. One of the things is accountability. There's some speculation and discussion in the community that people who are hooked up to these devices have the possibility of being influenced by the machine. So in other words, they're thinking about something, but the machine doesn't interpret correctly and takes an action that the person didn't really intend. So the concern is would they be accountable for it? And there's no way to make that determination. However, it's a valid question, because if the machine doesn't, if I say, for example, I want to go left and machine takes me right and I run over somebody with my wheelchair and hurt them, is it my fault? So it's a definite issue that has to be addressed. Unfair advantages. BCI, depending on the type it is, can give somebody an unfair advantage. There are devices that will go ahead and enhance strength. So for example, if you're competing for a job where you have to have good muscle strength, and you have a BCI, a mechanical device that gives you an advantage, is it fair for you to compete for the same job that a normal person would? They don't have that advantage. You can also have implants in your brain that will go ahead and increase memory. It's almost like upgrading the RAM on a computer. These devices exist and they allow for improved memory retention and storage. So does it give somebody an unfair advantage? It could. The laws that govern BCIs vary from state to state. So what works in one state may not be applicable in another state. So there's no one standard. So you have to be careful when it comes to how laws are applied. And it is a concern because, like I said, what works in Georgia may not work in Mississippi or vice versa. Reliability. Using these devices for things like trying to go and get a patient to answer a yes or no question, trying to go ahead and interpret what somebody is thinking about doing. The devices aren't as reliable as people believe. Depending on the BCI itself, that reliability can weigh from 65 to 85% of the time. So you have to be careful about trying to go ahead and use these devices in a court of law, for example, to get a patient who's paralyzed, can't speak, can't move, to answer yes or no questions, because just because the device says it's yes, it may not be yes. They may be thinking no, but it gets interpreted incorrectly. Evolution. I ran across in my study one scientist who actually believes that BCI is the future of mankind. In other words, he doesn't believe in using them just to go ahead and help patients who are in a locked-in kind of vegetative state. He thinks that everyone is going to eventually be wired with implants that will allow them to go ahead and communicate, just kind of like, if any of you are Star Trek nerds, kind of like think the Borg, and that's where he's going, but not with all the mechanical devices, just the implants. People having enhanced memory and things like that. Being able to communicate on the web without using a computer, just by thinking about it. Having a Wi-Fi nearby and thinking about your friend and having a mental link with them over the Wi-Fi. So that's where he thinks it's going to go. And not everyone in the community agrees with him. Now, the research questions, the way I posed them, were centered around how much does the public know about the use of BCIs for patient care and memory or physical augmentation. So the next was how much does the public know about the ethical issues regarding the use of BCIs. And lastly, what's the public's level of acceptance regarding the use of BCIs when weighed against the ethical issues? So everything was all based about these devices are out there, they're being used, but what does the public really know about them? And the research questions were answered based on surveys that were distributed to the staff and students at Central Georgia Technical College. I sent them to 100 staff and then 400 students. And for this survey, I kept it simple. I just collected demographic data to get the age of the survey participants. in addition to what they thought about the use of BCIs. What I found from the results was that based on the age categories you see, there was a very difference in the amount of knowledge the general public had about BCIs. I mean, for example, what they even were. They had a similar corresponding level of knowledge regarding the ethical issues. So the same kind of pattern you saw on the previous slide is what you're seeing here. So they understood about BCIs, knew what they were, and they knew what the ethical issues were. And the last question was, would they accept the use of those devices in spite of the ethical issues? And what my research showed was that based on the age categories, it was an inverse. So the groups that really understood what BCIs were and the ethical issues were less likely to accept use, because of the ethical issues involved, whereas the other groups were more likely to say, well, yeah, why not? So yeah, sure, we can use them. And like I said, this is all just based on age. So the conclusion I came to was the data appears to suggest that the 31 to 35 and 36 to 40 age groups were the most knowledgeable of the use of BCIs and the ethical concerns involved with their use. The data also appeared to suggest that the 31 to 35 and 36 to 40 age groups were also less willing to use the BCIs because of the ethical issues involved with their use. The other part of the conclusion is obviously the study needs to be expanded to include other biographic data such as education level, income, ethnicity, and things like that, because the age just doesn't give a good enough picture of the type of groups of people that this would apply to. However, it was an interesting study, and I appreciate your time and your attention. Thank you.